Welcome to the clinical pharmacology class. My name is Rafiz Kamaliv, and today's topic is biotransformation. Humans and other animals consume much xenobiotics, and they that may be the food, the uh, drugs, and substances that can be taken in purpose, or they can taken uh, by chance. So, and the substances can enter the body through the mouth, skin, and lungs. So, because uh, many substances are in the air, water, and uh, the humans can be exposed to these substances even without knowing that. And most of the substances will be biotransformed in the body, and biotransformation usually will decrease the activity of the drug, but for some drugs the biotransformation will activate or increase the activity. And this this will this decrease in activity usually also promotes the elimination of the drug, and for some substances biotransformation uh, can increase toxicity, and that can lead to the poisoning. So that is why it's very important to understand the biotransformation, and there are uh, several ways on which the biotransformation can take place. And uh, so the biotransformation uh, is one of the uh, is is divided to the two uh, two phases, so phase 1 and phase 2. So phase 1 and phase 2. The uh, the main parts where the drugs are biotransformed are the liver, and most of the enzymes that will biotransform the drug are located in the liver. So there are different paths that may lead to the biotransformation, and this is one of the ways that most drug uh, will will be terminating their activity, because usually drugs are high molecular and they are not excreted well by the kidney. So only small molecules that are polar and dissolved in water very well can be easily eliminated by the kidney. So that is why for most of the drugs, uh, they they don't have such properties, and because most of the drugs are lipophilic and usually are unionized, or maybe only partially ionized at the physiologic pH. So that is why they are not filtrated in the nephron, and then they cannot be eliminated by the urine. And also the lipophilic drugs are usually bound to plasma proteins, and that also decreases the filtration rate in the glomerulus, and that usually leads to a prolonged duration of action, and most of the time the termination of the action depends only on renal metabolism. So and in so the metabolism is one of the ways that lead to the termination of such drugs, and lipophilic drugs become more polar, and that is why they are readily excreted by the uh, kidney. So sometimes the metabolism is uh, very fast, and for example the phenobarbital and sodium thiopental are very fast metabolized, and and only because of the metabolism. So and the most of the metabolism occurs between the absorption and elimination. So mostly in the blood, the tissues, and the liver. Sorry. And there are, however, there are some metabolism that occur in intestinal lumen and intestinal wall. So there are two categories of the reactions. There are reactions of phase 1 and phase 2. And phase 1 reactions are oxidation, amination, and sulfuration. So they will lead to the addition of the hydroxy, amino, or sulfur groups, and often the metabolites of these reactions are inactive. So so this is a case of this drug that can usually it is inactive metabolite on phase, it becomes an active metabolite on phase 1. And actually if the uh, polarity of the metabolites is high, they can be excreted by the kidney. But if sometimes it's not enough, and that is why the drugs go subsequent biotransformation on phase 2. And phase 2 reactions are conjugation reactions, and the conjugation is usually done with the glucuronic acid, sulfuric acid, acetic acid, or an amino acid. These are combined with the inactive drug metabolite and will form a conjugate. And this is the most common case. However, sometimes the drug will go directly to the phase 2 and will form a conjugate, and then will be eliminated. So without phase 1. So for example, on the in isoniazid, so this is a isoniazid, we'll go to the phase 2 acetylation on the first step without. So usually phase 2 is the first step, but here the phase 1 is the first step, and here the phase 2 is the first step. And the hydrazine moiety will be acetylated so, and hydrazine will form the N-acetyl conjugate, and then this conjugate will be reacted with phase 1 reaction, hydrolysis. So, and hydrolysis goes by the aesthetic bone and will form a isonicotinic acid. So and in this example, the phase 2 is the first step and phase 1 is the second step, but this is usually not a case. And usually also the drug can skip both steps, phase 1 and phase 2, and or the drug can be metabolized in phase 1 and can increase activity, and then can conjugate on phase 2 and decrease activity, or sometimes even increase activity in phase 2 also. So and usually during this process the lipophilic drugs will become hydrophilic drugs, and that increases the elimination rate of the drug. And the main organ of drug metabolism is liver. The GI also can make some biotransformation, including and also the lungs, skin, and kidneys, but most amount of the metabolism is in the liver. And Most of the time, the drugs are absorbed unmodified from the small intestine, and first they are transported to the portal system to the liver. And just after absorption, they first undergo the biotransformation, and this is called the first pass effect. The first pass effect is common for all orally administered drugs, and uh, some drugs are metabolized in the intestine, for example, clonazepam, and other drugs are metabolized uh, uh, even uh, even more in the intestine than in the liver, and so the intestinal metabolism can can occur uh, additional to the first pass effect, and that will usually decrease the bioavailability of the drug. Uh, uh, and uh, in the patients with uh, liver diseases, the intestinal metabolism will be the main way of biotransformation. And also, if the metabolism in the intestine is decreased, that can lead to the overdose and uh, increased adverse effects because of the elevation of the concentration in the blood. And sometimes, because of the first pass metabolism, the effectiveness of the drug is limited, and the drug must be taken uh, with another route of administration, like for example, lidocaine should be used only parenterally because it's not active. It will be not active by oral administration. And in the intestine, the biotransformation can be done by the intestinal microflora, and also some drugs can be metabolized by the acid in the gut, or by the digestive enzymes, like for example, insulin is not active orally and should be injected because it's completely metabolized by the digestive enzymes. So uh, and most of the biotransformation is catalyzed by the cellular enzymes, and these enzymes are located in the endoplasmic reticulum, mitochondria, cytosol, lysosomes, or in the plasma membrane. So, but mostly in the endoplasmatic reticulum. So most of the drug uh, enzymes are located in the endoplasmatic reticulum membrane of the liver, uh, and the uh, there are two types of the endoplasmatic reticulum: rough, that has the ribosomes, and smooth. So the rough endoplasmatic reticulum uh, usually synthesizes proteins, and the smooth endoplasmatic reticulum is usually uh, responsible for drug metabolism. And the smooth endoplasmatic reticulum contains uh, enzymes uh, that are called the mixed function oxidases or monooxygenases. The these enzymes require the NADPH and molecular oxygen, and usually one molecule of oxygen is consumed per uh, reaction. uh, and the sorry um, the enzymes that play a vital role in this reaction are NADP cytochrome P450 oxidoreductase, and the second one is the cytochrome P450. So the second enzyme, that is usually abbreviated P450 or CYP, is the limiting step reaction, as a limited step reaction, and that is by the depending on the activity of that enzyme, the activity of all the biotransformation in the liver uh, can be modified. So the drug oxidations are require both P450 and P450 reductase, NADPH, and also a molecular oxygen. So this is the uh, schematic representation of the reactions that occur in this process. So this is a cyclic process. So the uh, first step, the oxidized P450 is combined with the drug and forms the uh, complex. Uh, then on the second step, NADPH uh, donates an electron to the flavoprotein P450 reductase. So this is NADPH will donate electron to this enzyme. So this is a key enzyme, and then uh, the enzyme is produced, and uh, the the second electron uh, the second electron is introduced from the NADPH via the P450 reductase, and this activates uh, the oxygen uh, and complex of the drug with P450, and this is the third step. And the last step, the fourth, this complex transfers the activated oxygen to the water molecule uh, and to the drug. So, and that forms a oxidized drug. And then the P450 uh, uh, returns the oxidized drug back. And many drugs are oxidized by this system. So uh, the prerequisite for this reaction is high lipid solubility, and that is why the enzyme is not selective, but this biotransformation is relatively slow. So usually for the phase 2 reactions are much faster. And there are several types of the P450 enzymes that uh, that are classified into families, and uh, most of the about half of the uh, isoforms are 3A45. This is the most common isotype of the enzyme in the liver, and these uh, these enzymes will catalyze the most of the drugs. Uh, so and the activity of these enzymes can be induced by the drugs or by chemicals, and induction will result in the faster metabolism, and that lead to the decrease in the pharmacologic action. So uh, sometimes when the drug is activated by the liver enzymes, that can also lead to the toxicity. And there is no any specificity, and uh, the inducing can be done by the environmental chemicals and also uh, pollutants, for example, pollutants of the water, and uh, also, for example, the activity of these enzymes frequently induced by the smoking cigarette, because smoke of the cigarette contains uh, hydrocarbons like the polycyclic aromatic hydrocarbons and also benzopyrene, and uh, other organic products that induce the enzymes and that can uh, alter the metabolism of the drugs. And some uh, uh, organic chlorine compounds also can lead to the induction of the enzymes, and uh, but they are mostly used in the chemical synthesis on the factories. And the increased synthesis of the P450 requires the enhanced transcription and translation, also the increased synthesis of heme and its cofactor. And the translocation of the receptor uh, into the nucleus leads to the uh, reaction with the cytoplasmic receptor, and that leads to the activation of the genes that will code for the liver enzymes. So, and that leads to the induction of the enzymes. Also, the cytochrome enzymes can be induced by the vegetables of the cruciferous family, and also by the omeprazole. Omeprazole is the proton pump inhibitor used for the treatment of the uh, 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 ulcer. And the other plants that can induce the uh, enzymes include the Jones wort that is very popular uh, uh, medical uh, plant, and also the phenobarbital is induces the enzymes uh, with the similar mechanism that uh, for the drugs will do. So also the activity of the enzymes can be increased by substrate stabilization because of the decreased degradation, and that is the case on, during the alcohol consumption that will lead to the uh, induction of the cytochrome enzymes. Then the inhibition of the enzymes is common for imidazole-containing drugs such as cimetidine and ketoconazole because they bind tightly to the P450 heme iron and effectively reduce the metabolism of the uh, uh, some substrates and co-administered drugs and themselves also. Macrolide antibiotics such as uh, erythromycin and its derivatives, and uh, they are metabolized by the cytochrome P3A uh, that form complex with the cytochrome P450 heme iron, and that makes it inactive. And some drugs will irreversibly inhibit the P450 via covalent interaction, and uh, the some antibiotics like chloramphenicol are metabolized uh, by the cytochrome uh, and then modify the P450 protein and inactivate the enzyme. Uh, there are also suicide inhibitors that inactivated the that attack of the heme or the protein moiety, and that includes steroids like ethinyl estradiol, norepinephrine, and spironolactone. Uh, Also, the analgesic sedatives, diethylphentamine, and carbon disulfide, as well as the grapefruit furanocoumarins, selegiline, phencyclidine, ticlopidine, and clopidogrel. as well as ritonavir and uh, many other drugs. And uh, also some unknown mechanism is done by the mifepristone, haloxifene, and tamoxifen. So these unknown are actually used for the abortion. Uh, the phase 2 reactions uh, uh, undergo uh, the conjugation reaction, and in uh, most of the time the conjugates are polar molecules, and they are readily um, eliminated by the kidney and usually are inactive. And the enzymes that make that phase 2 reactions are usually transferases. They are usually are located in the cytosol of the cell, and the most common enzyme is uridine 5-diphosphate, or UDP. uh, uh, and uh, these enzymes catalyze the coupling of the activated endogenous substrate with the drug. There are many of these genes, so the most common of them is U2Gs, so that's about 60%, and there are many others like sulfotransferases and the glutathione transferases and acetyltransferases that are, for example, we already talked about the acetyltransferases for the isoniazid, and also the uh, many other transferases that will lead to the conjugation. And these phase 2 reactions are relatively faster than the P450 catalase reactions, and that accelerates the biotransformation. So I think we also have to accelerate because we are running out of the time. So most of the drugs will biotransform to the non-active, for example, but sometimes they also increase the activity. So the for example, the metabolite of the morphine, morphine 6-glucuronide, is even more potent than the morphine itself. And sometimes drugs can be metabolized to the toxic products. And for example, the paracetamol or acetaminophen has a hepatotoxicity due to the metabolite. toxic metabolite. So the acetaminophen that is actually very safe usually undergoes the glucuronation and sulfation with the completely uh, 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 inactive product, and then accelerated by the kidney. But there is an alternate sulfuronation by P450 dependent glucuronic sulfur acid, and that pathway is usually not very active, but when the dose of the acetaminophen increases, the glucuronation and sulfation pathways are saturated, and the P450 dependent pathway becomes more active, and when the P450 pathway is not very active, there is no hepatotoxicity. However, when it activated, the toxic metabolite will accumulate, and in the absence of the intracellular nuclear fields like glutathiones, like glutathione sulfhydrylic groups, these reactive metabolites will lead to the hepatotoxicity. And the antidote for this toxicity is the cysteamine, or N-acetylcysteine. So the administration of this antidote within 10 hours after acetaminophen overdosage protects the patients from the hepatotoxicity and death. So the glutathione sulfhydryl group is not an antidote because it will not pass through the membrane. So I think that is all for today, and thank you for your attention, and see you next week. So if there are no questions, so see you next week. Bye bye.
Okay, Professor. Thank you for today.
Thank you.